Good evening and welcome to Health Check. This is your live medical show for all matters health. Now, children can be born with deformities, but then the one thing that we need to realize is that most of these deformities are actually reversible. We're talking about the cleft lip, the palate, the club foot, the bow leg. And today, helping us with this conversation is Dr. Federico Sibona. I was telling him his name sounds South African. But anyway, he's a pediatric orthopedic. Yes, and he will be helping us with the discussion regarding these various deformities, even more than what I have mentioned. And definitely, you can share the link with your friends and family who may need this conversation of the day today. We're live on YouTube and also Facebook. You can also send in your questions on WhatsApp 0708 222 You can send in any questions that you may have for the topic of the day today. And also, just to remind you guys about our campaign that is currently running 100 for one. Beautiful, beautiful campaign where we're reaching out to more souls, and you can get to be part of that by contributing 100 shillings or more to the payable number 933933, account FOH Health Check or Hope TV. Just FOH is also okay. So thank you so much, guys, for your continued support, even as we continue to take this ministry to the next level and to reach more and more people. Now let's get down to it. Habari yako?
Salama.
He knows Swahili, like a lot of it.
Unajaribu tu.
Unajaribu tu. In Kikuyu, we say no kogeriamani.
Oof.
I won't ask you to repeat. Yeah, but anyway, Dr. Federico, you're very much welcome.
Thank
Please
you so
give
much.
us an introduction.
So I'm
Mm.
a pediatric orthopedic surgeon from Italy. I've been training throughout in Italy up to 2017, and then worked
Mm-hmm.
as a pediatric orthopedic surgeon in Italy. I did my fourth year of residency actually between Tenwek Hospital and Kijabe Hospital,
Right.
and then since then. We thought about coming back as a family. We have five children,
Mm.
of which two are Kenyan, and
Mm.
my wife is a gynecologist that works in
Mhm.
Kijabe Hospital.
Oh.
So we've been here 3 years and
Mm.
3 months, and we really felt welcome
Yeah.
from this country, and we are hoping to stay more and more
Yes.
here.
Mm-hmm. All right. Karibu sana.
Asante.
So you'd say that Kenyans are friendly.
Yes, yes, I would definitely say so. And with
Yes.
AICQ International Kijabe Hospital,
Mm.
we've been traveling the almost the whole country,
Yeah.
and we've been seeing throughout people that are welcoming us
Mm.
all over the country, from Mombasa to Kisumu
Mm-hmm.
to Lodwar to Kargi to Oloitoktok. I mean, all over around. We've been really welcomed
Yeah.
by the people, and as we try to give our best to treat the children
Yeah.
with especially with pediatric deformities.
Mm. Awesome. That's good. And you can continue to stay.
Thank you so much.
Yes. So let's get down to our conversation. I
Yeah.
think this, to some parents, this is almost a nightmare because, again, when you're giving birth to that child, there's then that expectation that you had. But then let's talk about it because this is something that is happening, that has happened to many children, unfortunately. So, what would you say are some of the common deformities in children?
So for pediatric orthopedics, the most common deformities are clubfoot,
Mm-hmm.
um, DDH, which means developmental hip dysplasia, which means that the hip at birth is going out or is already out of the socket, as the hip is a ball and socket joint. So usually you can imagine the femur going like this, like
Mm,
as my forearm to be the femur. So this part of the body going, and the ball is the head of the femur that has to be inside the socket. Okay. So when the child is born with hip dysplasia,
mhm,
the hip might be out or it might be almost going out, and this is especially something that we would really like to improve and implement in the country by by prevention, that means less surgery and less complications related with surgery. For clubfoot,
Mm-hmm.
mm, the same. The earlier you start treating clubfoot, the better the outcome, the less the surgery, and the better for the child.
Mm.
Other deformities that we treat a lot are bow legs,
Yeah.
knock knees. Those are not congenital. Those are developmental. There's a lot of causes for that, and we are gonna go through this hour of talk. Then there are other deformities of the upper extremities that we
Mm-hmm.
treat, like radial club hand, which means that the child is born with a hand that is looking on this side.
Oh.
Okay, that's much less frequent, but is one of the pathologies that we treat of the upper extremity.
Yeah.
The other issue that is quite common is the brachial plexus palsy, which means those children that had issues during deliveries, and when they are born, usually the arm is flay, is not
Mm-hmm.
moving much, or is like this, and the child cannot move it. So that's another topic that we can
Mm-hmm.
talk about it. And then we treat also scoliosis, which means deformity of the back. There are some congenital scoliosis that are much rarer than what is called adolescent idiopathic. It means that idiopathic means that there's no, at least that there's not known cause for that.
Mm.
And those are much more frequent, especially in young girls. And that's mostly treated by conservative treatment, which means no surgery or
Okay.
up to surgery. And we treat all these conditions that cure.
Mm-hmm.
Then, as we were talking before, we do throughout the years many of these surgical camps helping children with
Mm-hmm.
cleft lip and cleft palate. That is a more of a plastic surgeon topic, but we select the children for the plastic surgeons. Actually,
Mm-hmm.
we have a plastic surgeon that is working for cure, that is
Right.
treating this condition, and then 3 or 4 times a year there is a team of three surgeons that is coming through Smile Train to do free surgeries for cleft lip and palate.
Mm. Oh,
Yeah.
awesome. All right. And now maybe talking about the cleft lip and palate, I think that's something that I've come across actually most children even, having that particular condition. So maybe let's talk about the cleft lip and the palate. What's the difference and also what causes it?
So for the cause, there's no specific cause. It's a combination of environment and genes
Okay.
um, that are causing this when the child is
Mm.
born. And smoke is a risk factor, diabetes is a risk factor, and
Mm-hmm.
also some anti-epileptic drugs
Yeah.
um, are a risk factor for the pregnancy. So that it doesn't mean that if you have those risk factors, your child is going to be born with cleft lip or palate, but those
Mm-hmm.
increase the risk of such a condition. So for the cleft lip, um, it's what we see from the outside. This is the most common and worrisome
Mm.
problem for the parents, because aesthetically you have a cleft, like you have a hole in the
Mm-hmm.
in the lip, but the cleft palate is not visible, not unless the child opens the mouth,
Mm.
and then you can see it inside the mouth. There's a cleft. It's like the part of the palate is open. So sometimes you can have both associated, so both
Yeah.
cleft lip and palate, or more commonly there's just the cleft lip.
Mm.
So while we treat these conditions, um, we do cleft lip since 6 months of age. It's advisable to treat cleft lip before the age of 12 months.
Okay.
Most of the time, we don't do before 6 months because of the weight of the child. This is
Mm.
more of an anesthesia related complications, because now you have to make this surgery on a safe environment. So
Mhm.
the child must be having a certain weight to be eligible for such a surgery, where we close the cleft. We have a lot of pictures even in our website of Cure International.
Yeah.
You can see the picture of the child pre-op and post-op,
Yeah.
and then that is usually before the age of 12 months, and then usually before the age of 18 months. Or we tend to separate those two procedures. We don't do the cleft lip and palate together. We first treat the cleft lip,
Mhm.
and then we treat the cleft palate. Usually we separate those two surgeries at least
Mhm.
6 months apart.
Mm.
Yeah.
Oh, wow. Wow. All right. And maybe when we look at both the cleft lip and the palate,
Mm.
is it possible for a mother to actually see this during the screening, or is there any other deformity that can actually be recognized, before the birth of the baby?
So the cleft lip could be seen
Mm.
with an ultrasound, but is not always something visible. Now, some forms of especially cleft palate, those are hard to see, especially because the child can open and close his mouth, so
Yeah.
it's not it's very hard to get cleft palate. But for the cleft lip, it can be diagnosed, especially when you do the second trimester
Mhm.
ultrasound. Though I'm not really an expert on maternofetal medicine, especially on cleft lip, because this is more of a plastic surgeon thing. But yes, for the cleft lip, in most of the cases, it can be
Mm.
seen throughout the ultrasound. Especially right now, there's 3D and 4D also ultrasound, which is very precise and can detect such deformities. But in the West, and especially clubfoot or other conditions, are a cause of abortion, and we do a lot of counseling,
Yeah.
because both conditions are treatable, and they can be
Mm.
treated within the first 6 months of life of the child. And then there's a success rate that is above 95%, which means
Wow.
that the child can do everything he wants in his life. And
Mm.
most of the time when we treat especially cleft lip, it's barely visible after the surgery.
Oh,
So
wow.
we have very, very nice results, and um, the parents should not be ashamed of that. They
Mm.
they they can just come to Kyo Hospital or also Kijabe Hospital for
Mm.
such a condition, and they are treatable. And we, especially for cleft lip and palate, both of our hospital, they do that through Operation Smile Train. So those are
Mm.
free surgeries
Yeah.
that can be done at any time, but the earlier the better. So for all the parents that are having children with such condition, both of them are treatable. The success rate is very high,
Mm.
and even aesthetically, it looks very good, and the
Mm.
children have a normal life.
Mm.
Yeah.
Wow, that's good hope
Yes, definitely. Yeah,
to
yeah,
give to the parents out
yeah, yeah.
there who are even watching us. And you guys can also send in any questions that you may be having. Remember, the WhatsApp number is 0708 222 And now let us talk about the bull legged and also the club foot. What does the correction look like?
So especially for clubfoot can be diagnosed sometimes already at 13 weeks of
Hmm.
gestation,
Yeah.
but most of the time is around 20 weeks
Okay.
with the ultrasound.
Hmm.
Um, it's not 100% accurate. Sometimes it's just how the child um, puts the foot in that moment that you do the ultrasound. So it looks like a
Mm.
club foot, but it's not 100% of the times a club foot,
Okay.
because it might be just a positional club foot, which means that the position of the child in that moment looks like a club foot, but is not rigid. So the clubfoot is a deformity that has what we call equinus. Equinus means that the foot
Hmm.
is in this position and cannot go up like that. It's very rigid in this position.
Oh.
Then it has other deformities. So it has um, adduction, which means that the foot is looking inward,
Mm.
and then supination. It means that the foot looks um, upward, and then cavus, which means that it has it's concave on this side, and then varus, which means that the hind foot, the back part of the foot,
Mm.
goes towards this side. So those are the main deformities that characterize clubfoot.
Yeah.
But I don't want it to be too technical. So the thing is
Mhm.
that we have to talk about it. It's something that is treatable.
Right.
It's something that it has very successful as a treatment. The earlier, the better, right?
Right.
So a child is not an emergency because parents are really getting worried when the child is out, so they would like to be treated the first day of life. It's not
Mm.
an emergency. It can be treated within the first week. Usually, we start at 1 week old.
Ah.
Yeah, so that the,
Okay.
the parents can just go home, take the
Mm.
child, and then stay with the child a little bit in the house, and
Yeah.
then they can come for the first consultation. And since at least 20, 30 years,
Mm.
there's this treatment called Ponseti treatment. He was a Spanish guy that he used to live in the U.S. In Iowa, and he started this treatment. So everybody thought he was a crazy guy because surgeons, they want to do surgery,
Yeah.
right? So everything that is not surgery is not good for a surgeon. So because we like to correct the foot with
Yeah.
surgery to be straight, and that's it. So
Mhm.
actually, he realized that the correction with casting is much better, leads to less surgery. So usually, when a child has clubfoot and is 1 week old, we put the first cast. So every week or every 2 weeks, depends on where the parents are living. If they come from far because they can't afford to come every week
Yeah.
because of the fare,
Mhm.
um, we do it every 2 weeks. So every week or every 2 weeks we do a cast, so the foot slowly gets to be straight. And
Mm.
then 90% of the cases, we do a small procedure, not even in theater, we do it in outpatient. So we cut a tendon, the Achilles tendon, that is located on the hind foot, on the back of the foot, for the foot at the end of the correction to go
Mm.
straight like this.
Mm.
So this is done under local anesthesia. The child won't suffer any pain, and then we put
Yeah.
the last cast for 3 weeks.
Mhm.
In the tendon, so Chinese are kind of special in those things because they did also MRI studies on magnetic resonance studies on the kids after this procedure, on
Mm.
or a bit older kids. But you can see that in 6 weeks, the tendon is perfect. You can't even see that something was done on the tendon because the tendon comes back. Our body is magnificent.
Mm.
So the tendon can come back, and nobody would even know that something was done.
Yeah.
So especially for the parents that are coming from far, if you're listening to us today, no matter where you come from, even if you come from far,
Mm.
usually what we do, we have an hostel at Cure.
Okay.
So for the patients that are coming from far and they can't commute every time, they stay at Cure. That's a fast cast protocol. So we put 2 casts in a week. So usually in 2 to 3 weeks, we treat the child
Mm.
from the beginning to the last cast, and
Right.
then they can be sent home. And then after the last cast, they have to put a brace, which is
Mhm.
boots and bars, especially nap time and in the night time, that helps keep the correction. So that is important because once it's a cooperation between the surgeon and the parents.
Right.
So once our job is done,
Mhm.
now the parents have to help us. Okay, so help us keeping these boots and bars, this brace for the children, nap time and in the night. We start with 16 hours and then you go up to 12 hours
Mhm.
until 4 to 5 years old. Okay, the children get used to that. It's the parents most of the time that they don't get used to that because they see the child that has
Yeah.
this fancy thing and they don't like it. But the children can adapt to everything.
Right.
So even the parents, they have to understand that this is as important as a plaster.
Yeah.
For us to get this success rate that usually in club foot that is not associated to any syndrome, to
Mhm.
other pathologies, to other issues, to other illnesses, is above 95%, which means that just with casting and a small procedure, more than 90% of our patients can get through, and they can have a normal life. They will
Mm.
play. They will do everything.
Mm.
Steven Gerrard was a former professional player. He had club foot,
Yeah.
but he went to the top,
Wow.
and he did it as a pro. So
Mm.
everybody will be having the same hope
Mhm.
through working hard. So club foot should not be a cause of abortion, and should not be a cause of stigma in the
Yes.
people and in the families with that. So please, uh, we treat this for free. So if you have a child or a relative of a friend
Mm.
that has a club foot, please, we have an office in Westlands, Paca Road, nearby Sarit Center, and we have clinics on Monday, Wednesday, and Friday. Then we have our clinic every day in Kijabe. We can see the child. We can talk to you as parents. We
Yeah.
can suppress all the doubts that we have. We are here to help, and
Yeah.
that's what I feel the most coming from another country, to try to give my best to the children, because
Yes.
children are the next generation of the country.
That's true.
So they will be the next leaders
Yeah.
of this country, and don't be fearful. Everything is gonna be fine.
Mm, wow. That's really good hope to give to the people. And you mentioned a very important bit that this is not a cause for alarm or abortion or anything of the sort. This is something that can be reversed. And you mentioned that actually these services are for free. So there's no reason why parents should not actually take the next step and go to these places like AIC Kijabe Care, where Cure, is it Cure or
Cure,
Care? Cure,
cure.
yes.
We care, but we are called cure.
Right, right. So you all can just keep sending in your questions if you have any when we go for the break, and when we come back, we'll also be looking at some of your questions just in case you have any. You can also let us know, where are you watching us from? Are you enjoying this conversation? Are you learning something? So we'll take just a very short break, but once we get back, we'll continue with the conversation.
Get ready for the most electrifying gospel event of the year, Praise Atmosphere 2023, on the 9th of December at Sitam Karen, Nairobi, from 2 p.m. onward, featuring Evelyn Wanjiru, Prosper Ochimana from Nigeria, Rehema Simfukwe from Tanzania, Edith Wairimo, Celestine Donkor from Ghana, Wilberforce Musioka, Solomon Mukubwa, Kestin Bogo, and Sharon Ishavuka from Kenya. Regular tickets are available for just 1,000 shillings, 2,000 shillings at the gate, and for the children 3 to 12 years, it's only 500 shillings. VIP and VVIP tickets are also available. Visit www.praiseatmosphere.com/events or use paybill number 800-8575, account Praise. Praise Atmosphere 2023, uniting hearts in worship.
It's finally here. The breakfast show that will kickstart your morning with a message of hope, coupled up with wholesome music, and of course, captivating conversations that matter to you.
We shall touch on topics on law, relationships, the Christian walk, and in addition, we will also be keeping you up to date with news and all the trending topics.
Join me, Bishop Watare,
And me, George Gishuru, every Monday to Friday from 7 a.m. to 9 a.m. on Hope at Dawn.
only on Hope TV, where you look
And live.
Next on Adam's Cave.
We have men in our society that can't kill a rat in the house.
Oh, yeah.
There are men who will not stand up for their right but they'll go in a toilet and cry. Yeah. So there's so many things that have changed because of absence of men. They have no examples to look at. The men who are old have intentionally or unintentionally created gaps in leadership, in churches, in politics, in schools, in all these business establishment, which have made them become the only bulls in the crowd.
Watch Adam's Cave this Friday at 7:20 p.m.
Welcome back, and thank you so much for the questions. We have several questions here, Daktari, so maybe we can get down to them. And remember, you can send in your questions on WhatsApp. That is on 0708 222 So, moja nauliza, please ask Daktari, how long does it take to heal from clubfoot? My neighbor has a son who was treated about 3 years ago on his clubfoot. By then, was 12 years, but up to now, he has not fully recovered and he still uses the support shoe. Plus, what should he do also to get well?
Okay. So usually that's why we were talking about the earlier the better.
Yeah.
It takes 5 to 6 weeks in a newborn to correct the club foot. For grown up, that's much more of a difficult treatment because it takes more, because the tissues are not as plastic
Right.
they to mold as in a very small child. Okay, like, because you can see that when the children are born, their joints are much more lax. They have a
Yeah.
much more range of motion, and then when you grow up, that range of motion decreases a bit.
Yeah.
Okay, not unless you are a gymnastic, but that's a different story. So all the joints, they become a little bit more rigid as you grow up. So for the children that are older, it takes longer. So usually we take we do casts up to, it could take up to 2 months of casting before we do surgery. But
Yeah.
let's say that when a child is older, most of the time the tenotomy, so the cut of the tendon, is not enough. So you need to do a bit more of a surgery to get the foot straight.
Right.
But we have treated children up to, well, they're not children anymore, up to the age of 24. We had treated children or young adults, let's say,
Yes.
for club foot. Sometimes when the club foot is so severe, because people have never seen a doctor, so the leg looks like a hockey stick, so actually the
Oh.
foot looks like this. Okay, so to get it straight up to here, it's a journey. So we use what is called an external fixator, which people usually understand if you talk about aerial. You are, it's something that it stays outside. It has some wires. And they call it chuma chainje, just to be easy to understand. So basically, because if you correct in one go the foot, it tends to be pretty rigid afterwards. So
Okay.
with this external fixator, you do a slow correction that usually takes around 2 to 3 months, so that the foot can become straight without major bony surgery, and it gives very good results. Though it's a process that is a bit longer. So to answer the question, it
Yeah.
depends on the age of the child. If it's a small child, usually, if it's what is called idiopathic, so there's no cause that we know, and there's no other syndrome, there's no other sickness, it takes, let's say, 5 to 6 weeks from the first to the last cast. Okay. Now for the grown up, let's say 2 to 3 months to be treated, because maybe 1.5 months for casting, and then 1.5 months after the surgery, because usually after the surgery you need to have a cast for 6 weeks, and then we remove the cast, we put back another cast on which the child can walk on it. So
Mm,
I would say 3 months more
mm,
or less
mm.
to be treated. But the
Okay.
treatment is a bit more difficult. But we treat people up to with club foot that has never been treated up to the age
Yeah.
actually of 24
Mm,
was the oldest that we've been treated that never had
okay.
surgery.
Mm.
Yeah.
Then that means that 3 years is very long overdue for
Yeah. So I don't know. It's
the
sometimes what
child is
happens.
12 years.
Yeah. So what happens is sometimes the treatment is incomplete. So
Right, right.
especially some people do casting, but then they say we are not able to do the surgery, so
Yeah.
go somewhere else. So people maybe they've already exhausted all the money that they have. So so they don't know where to go,
Mm,
and they don't know what to do. So actually they remove the last cast and then they leave the child be, so
mm,
that the deformity keeps coming back.
yeah.
So now you have to start fresh again
Oh,
with casting and then surgery.
yeah.
So that's the issue. That's why sometimes it takes long, because the treatment is not complete. So if you do just half of the treatment, now you can't treat the club foot correctly. Yeah.
Mm, oh, wow. Wow. Okay. I think I do hope that this person who has sent in this will just advise them to probably just go for the full, process so that they can recover.
Yeah,
All right.
definitely.
There's also another question here. What causes hydrocephalus and is it curable?
So it's again, this is most of our, so
Mm-hmm,
we don't treat hydrocephalus per se.
mm-hmm,
That is treated in Kijabe Hospital. Actually, we are neighboring hospital. So sometimes people, when they come to cure, they go to Kijabe Hospital. So we are neighboring hospital. We work together. So this part is done by Bethany Kids, which is part of Kijabe Hospital,
mm-hmm,
and they treat hydrocephalus, which is an abnormal accumulation of cerebrospinal fluid on the head. So when you see those children with a big head because there's too much liquid, so the treatment is to put a shunt, so divert that excessive fluid that
mm-hmm,
keeps forming somewhere else, so that the diameter of the head decreases, and the child is doing much
mm-hmm.
better.
Wow.
So usually this is also associated with spina bifida or myelomeningocele, which is in few words like the spinal cord when the child is born is kind of out from the skin, is very
Right.
visible. So the neurosurgery can close the defect, so to cover back the structures that are passing there, so that they are covered by soft tissue and skin. So repair the
Mm,
defect,
mm,
repair the sac that was outside, that's supposed to be inside, right? So that's usually is done within the first week of life.
mm-hmm.
um, and then after that, what we treat of hydrocephalus myelomeningocele is what comes with it. Because most of the time, those children have issue of walking.
Okay.
And there are different levels. It depends where the spinal cord has been affected. So the lower, the more independent the child will be, where the defect is or the problem is. So some children are wheelchair bonded.
Mm,
So in this case, we treat actually mostly at the hip if the hip is painful, or if the hip assumes a position that is very difficult to get on a wheelchair. But some of them they can walk, so
mm-hmm.
but they have clubfoot related to spina bifida. So we
Oh.
treat such a, which is kind of usually more rigid
Mm,
of a clubfoot, that takes longer. Okay, when I was telling idiopathic clubfoot is different from spina bifida, arthrogryposis, cerebral palsy. Those are all different sorts of.
Mm.
It's still clubfoot, but it's related to something else
Okay.
that is affecting the body, and this makes the treatment a bit more difficult and longer.
Right.
Okay,
Mm.
but it's still treatable, and
It's
we
treatable.
definitely treat
Mm.
it every single day. We can't miss a child with spina
Mm.
bifida, arthrogryposis, or cerebral palsy.
Mm.
That so let me just talk a little bit about cerebral palsy.
Yeah.
Is one of the most common causes of disability. So one child every 500
Mm.
in the US, in Europe, everywhere in the world is born with cerebral palsy. So
Wow.
cerebral palsy is it's something that is characterized by a non-progressive um, issue that comes from the brain.
Mm.
Sometimes it's that's why it's important to talk prevention. Yeah.
Mm-hmm.
So the um, the frequency of cerebral palsy is higher where people are born in the house. Okay, so it's very worrisome to me after we fought a lot to have hospitals closer to the people. Then now people want to have birth in the house.
Yeah.
So my grandfather, my father, they were born at home, but because there was no facility,
Yeah.
and so now the frequency of cerebral palsy was much higher. I can understand about nature and stuff, but first safety of the children.
Yeah.
So in the hospital, we are not there to just to make surgery, or to rush someone to the theater.
Mm.
We are here to help, and to help the children to have less disability.
Yeah.
Okay, so especially for cerebral palsy, um, here where there's prolonged labor, when the parents are coming very late to the hospital, now the frequency of cerebral palsy is much higher,
Mm.
and that's a big stigma because we see that most of the mothers are left without the father, and this is really cruel because these children are the one that need the most both father and mother.
Mm.
No one is guilty. No one uh, has inherited something that can cause cerebral palsy,
Yeah.
right? So sometimes the fathers are making the mothers culpable of that. Don't feel sorry. Don't feel guilty about that. It's
Mm.
not about you.
Yeah.
And you are the only person that is taking care of this very precious child that has this issue. And in these cases, so in cerebral palsy, there are children that are wheelchair bonded, there are children that can walk,
Mm.
home ambulators, and there are other children that can walk outside, run, and do every activity. So the most common issues for children with cerebral palsy are again clubfoot, um, knee flexion contracture, which means that the children, when they walk, they cannot fully extend the leg,
Okay.
okay? Because the legs are flexed and they are very rigid, very stiff. So it's hard for them to put the legs straight. So when they walk like bending the
Mm.
knees, or they have hip issues. So that takes me to another issue that is preventable, that is
Mm.
much less worrisome if we prevent it,
Okay.
which is DDH, developmental hip dysplasia. It would be good
Mm.
to have a service that can do it's a 2 minutes ultrasound,
Mm.
right? Um, you need trained personnel, of course, because it's not that easy to
Yeah.
to have. But if someone can do it, it takes less than 2 minutes. And if the hip is outside of the socket when the child is small,
Mm-hmm.
you can actually using a brace or a plaster, you can keep the hip in, and the child is going to have a normal life, no problem,
Mm.
most of the time, no surgery. But here, there's no universal hip screening at 4 to 6 weeks.
Mm.
So when we see the children, usually is because the father and the mother, they see that the child is walking but is waddling, is walking in a funny way. So at the beginning, people say, oh, it's just because it's small, so
Yeah.
they can't know. It's very difficult to tell.
Mm.
Then you do an X-ray and you see that one of both hips are out.
Mm.
The child is perfectly normal, but the hip is out. So now to put it in is much more of a bigger surgery than when the child is small, because usually within 2 months of a brace or a cast, the hip is treatable in more than 90% of the cases. So we don't see, like in Italy or in Europe anymore, such things. It's very
Mm.
few.
Yeah.
Okay, so if someone can start hip ultrasound, it's gonna be very helpful for the whole country to decrease the rate of such big surgery and get
Right.
just children treated with a brace or a plaster. So
Mm.
this can be really, really of much of a help in all Kenyan children.
Wow,
Yeah.
that was really important information. And let us look at the other question. So the other one is asking what was wanaweza tibiwa cleft lip, maybe at the AIC Kijabe cure. And I think while you're at it, you can mention on the importance of early intervention, as compared to leaving it out and then later developing into other complications.
So yes, watu wazima wanaweza kutibiwa, because so the surgery as for clubfoot is the same. So the soft tissues are much harder to put back together.
Mm,
So let's say that the mm, the related complications to the surgery are a bit higher than in small children, but it's definitely treatable. Look, even in our website, there's a grown-up child that was treated not so long ago. We have like 14, 15, 16, 18 years old
mm,
children that were treated for a cleft lip or cleft palate, because the parents thought, well, the child is born like that, is feeding well, especially for the cleft lip only, so he has only an aesthetic issue. But then when they saw the change after the
mm,
surgery, they realized, wow, why we didn't come before. So
yeah.
it's worthy a consultation. Definitely come, don't worry. If we cannot treat it ourselves, we can refer you to
Mm,
Kijabe Hospital, if it's maybe more than 18 or more than 20, but it's worthy a consultation, right?
mm,
So just come, don't be fearful. We can give you advice on that.
mm,
Never give up. There's always something that can be done for your child,
yeah.
or for whoever has a congenital condition that has never been treated.
Mm.
Yeah.
Okay, all right. And I think I'm going to read out the last question.
Yep.
Hi, Beatrice. Ask Dr. Frederick, it's Federico.
Yeah, it's fine. It's fine.
What makes children born without spinal deformities acquire the deformity later?
Yeah. So most of the time,
Mm,
okay, so there are deformities that are not visible at birth, and then some children have some defects in the vertebrae. So
mm,
the bones that we have on the back, the backbones, uh, this is not visible at the beginning because the spine is small. So that when the child is growing, those defects are more visible. So,
mm,
but some of them are congenital. So for the most common type of issue, uh, which is adolescent idiopathic scoliosis,
yeah.
um, there's no definitive cause for that. Joint laxity, of course, is a risk, and it's more frequent in girls than in boys. Um, but there's no specific, like, if you can say, oh, there's one factor that can cause that. Not really.
Mm,
But the thing that has to be known, most of the people are waiting a lot to see if the condition gets better. So
mm,
that's almost never true.
mm,
Scoliosis, or backbone deformities,
yeah.
they rarely or almost never get better alone without
Mm,
treatment. So especially in adolescent children, if they can get a brace that can stop in most of the cases the scoliosis to progress,
okay.
to to avoid surgery. Not in 100% of the cases, but and that's the other problem because most of them are adolescent girls,
Mm.
so they refuse to wear a brace because it's visible in the body. But right now there are these braces that are quite thin, and if especially if you wear clothes, they are not really visible from the outside, and
Mm.
these are really helping the scoliosis not to progress, and in most of the cases avoid surgery in such a
Mm.
cases. So we take care of also of this, or the scoliosis. Our medical director, Dr. Teuri, is the one in charge, and Dr. Nyambati, my colleague, those two surgeons are in charge of uh, backbone deformities and in scoliosis. From the conservative treatment, which everybody of us do,
Yeah.
up to surgery that Dr.
Mm-hmm.
Teuri and Dr. Nyambati are doing whenever the deformity needs to be treated
Okay.
surgically. Yeah.
All right. And time is really not on our side, but maybe before we close, you can just maybe talk to a parent who has probably even hidden their child because they're scared of taking them out due to stigma and whatnot. And just basically, even as you wind up with your closing remarks, just encourage that parent who maybe has a child with one of these deformities and maybe they just feel hopeless.
All right. So
Mm,
I think there's nothing to hide whenever whenever your child has a disability. As
yeah.
we say, disability is just a word that people have made, but actually it's a different ability that
Yeah.
most of the ones that are supposed to be normal
Mm-hmm.
are not getting that different ability. So we are the disabled if we cannot see the different ability
Yeah.
that children have. So
Mm,
it's to change the our mind to
yes.
see what is special in this child, that nobody else is as special as your son or your daughter.
Yeah.
They are different because they have different powers
Mm,
that people are not willing to know. But once people are willing to know
yeah.
such a power, they will feel that all the other people that they think they are normal are the ones who are having problems. So um, actually, I started being willing to be a doctor, and especially a pediatric orthopedic surgeon, because my teacher in secondary school had a child with cerebral palsy that
Wow.
he was wheelchair bonded, and he got through all the study and he went up to the university, and he made me as a child, as a small child, to feel that there are people that have powers that we don't have, that I will never be like him. I will never be able to have such a power. And Kumbe is in a wheelchair, but is much more powerful than myself, and
Mm,
is helping much more people
yeah.
than myself. And I can walk, I can run, I can talk,
Mm,
but I don't have such a power.
yeah.
So that really made a change for me as a person, as a doctor, as a Christian, to see that people have a super people have superpower that
Yeah.
are just hidden to the most of us. So it's from us to open our mind and
Yes.
our soul to people that have such powers. And cure is there to enhance such powers, to make the parents knowing that we can help.
Yeah.
That's a duty. This is not something that we say, oh, we can. We have to.
Mm,
It's our duty to help these children that are becoming adults to be as independent as possible. So
mm,
please don't hide. Come. There's no judgment on that. There's just to be see another child that has special powers that nobody has ever understood,
yeah.
even as a parent or as a doctor.
Mm,
So please, we are open to that, and this is our mission
yeah.
to help children,
Mm,
um, and to heal the sick and proclaim the kingdom of God.
Yes.
That's our motto. Yeah,
Wow, that's beautiful. Thank you so much, Dr.
welcome.
Federico,
Thank you so
for
much.
coming through, for being here, for giving us so much valuable information, and most importantly, for giving hope
Yes.
even to those parents who maybe were feeling hopeless, even with the conditions that maybe their children may be having, and even the grown-ups as well. So thank you so much. And maybe as we wind up, what kind of services can people find at AIC Kijabekyo?
So mostly we deal with bone, joints,
Mm-hmm.
tendon. So every condition that is related to bone, joints, tendon, muscles,
Yeah.
we deal with that from upper extremity,
Mm-hmm.
lower extremity, and also the spine. We treat all of them. We are focused between the age 0 to
Mm.
18,
Yeah.
and then we also do prosthetics.
Okay.
We help the children that
Mm.
undergone amputation. And I want to make just a thing. Um, it's becoming more and more difficult for everyone to get very good prosthetics,
Mm.
because of waivers. So we need and help from the government
Yeah.
to heal all these children, to make
Mm-hmm.
them walk, to make them run, because that's a duty of a nation, to make these children able to walk. We don't want
Yes.
to see children that are missing prosthetics because of the price. So
Mm.
if we can be helped, especially on waivers on these materials,
Yeah.
that can be, because we are giving the children free treatment also for these prosthetics, which are
Yeah.
very expensive. So if we can be helped by the government about this, this will have the children to
Mm.
be running and to be part of this nation that is growing and growing.
Yes.
Yeah.
Mm.
So we are really appreciating
Mm.
if we could be helped on that.
Yeah.
Yeah.
Awesome. Awesome. And I'm sure that each and every person who is watching, we're really being told to finish up. But I just want to say thank you. I see Joseph Oleshura saying thumbs up, Dr. Federico, for the very clear and precise message. So thank you so
Thank you so
much.
much.
And I think this is also my personal message as well. Thank you.
Thank you, everyone.
For just giving us all this information and also giving hope to all the parents out there. AIC Kijabe Cure. You guys can go there. The services are actually free for all these corrections that you need done. There is hope. It's not a reason for you to abort. It's not a reason for you to hide your child. Bring them out. And I think my best takeaway has been these children have superpowers. You just have to open your eyes, open your ears, and you're going to find out that very child is just differently abled. So this has been Health Check. My name is Beatrice Watare. We've been chilling with Dr. Federico Sibona, and he has really given us valuable information on reversible conditions and deformities in children. So from us here, we just want to wish you a good night. My name is Beatrice Watare. Let's see each other next week. Bye-bye.